Israel's coronavirus vaccine program, already in the top of the world, now getting its booster with the rollout of Operation Back to Life. And as you might expect, Israelis are very excited. Nearly 1.9 million Israelis served with coronavirus vaccines as of Sunday, 50,000 of whom were given their second and final shot. And with the latest incoming doses, things are only getting better.
יום ענק למדינת ישראל, עם משלוח ענק של מטוס שמגיע במסגרת מבצע חוזרים לחיים, מטוס מלא זריקות עידוד.
Prime Minister Benjamin Netanyahu and Health Minister Yuli Edelstein hailing the latest shipment of coronavirus vaccines from Pfizer-BioNTech on Sunday. And Israeli health authorities are adding that they expect to receive between 400,000 and 700,000 new doses per week until the entire adult population is inoculated, with plans to administer upwards of 200,000 more shots every day. As for who gets their new doses next, teachers and Israelis 55 and older will now be included in the next eligible group for vaccinations, as opposed to just Israelis 60 years old and older from before. And this as nearly 75% of the 60-plus population has already gotten their first dose. Medical personnel then likewise breathing a breath of fresh air, safely for the first time in a year.
It changes everything. There's truly an excitement. I'm excited to receive the second shot. That means that within 10 days, 12 days, I'll have a 95% protection, which is a lot. It changes a lot for me.
But while the data shows Israel to be on the up and up, with most in every community obeying health orders, we're not out of the woods just yet. Authorities are urging the public to continue strictly minding lockdown measures as the morbidity and infection rates remain worryingly high, and some have yet to play ball. Reports showing that several yeshivas or ultra-Orthodox seminaries in the Mea Shearim neighborhood of Jerusalem reopened to students on Sunday, mainly for boys, and in spite of government orders to close. Meanwhile, police also handed out over 12,400 fines since Friday when the lockdown was renewed, thousands flocking to beaches and boardwalks under the pretext of exercise, and upwards of 130 people were fined for violating self-isolation orders, including several Israelis who knew they were infected but left to visit friends or just drive around anyway. Health experts trying to remain positive.
Hopefully, I hope that we'll get it through this wave, this immense wave of patients. We'll get it done. We'll be up to the challenge without many deaths. The toll won't be high.
Well, in any case, the number currently is quite high, with over 6,780 new infections reported since yesterday, bringing the new total of active infections to 69,762. 1,070 now still in serious condition, of whom 304 are in critical condition, and the death toll at 3,689. Joining us now to discuss these recent updates in the fight against the coronavirus, Professor Nadav Davidovich, Director of the School of Public Health in Ben-Gurion University, and as of yesterday, Interim Chair of the Association of Public Health Physicians. So, first of all, thank you for joining us, and congratulations on your new position. But tell me, Doctor,
It's an old new position. I was a chair for 6 years. Professor Levine replaced me, and now I got in, for the COVID.
All right, well, I guess we're glad to have you back. But so what does the arrival of the new vaccines mean for Israelis who are again locked up in their homes due to the coronavirus? Because despite the rise in people vaccinated, we're still going into shutdowns.
We're in a very strange situation. First of all, the arrival of this new shipment these are great news. It means that we finally are going to cover all the Israeli population. So all the questions that all over the world, about prioritization, about rationing, we are doing prioritization because we need first to have mainly those who are high risk and elderly, but now we can also get other being vaccinated and to start thinking about herd immunity.
All right,
On the other hand, so to show the numbers, we are not in a good situation. We are suffering from what happened here in the last month, especially during Hanukkah, mass gathering, weddings, people are returning from abroad. All of that is now reflected in the number of deaths and severe cases, unfortunately.
All right, well, going back to the idea of reopening as soon as that may happen, we've seen that now teachers are finally going to get inoculated with the vaccine. Does this mean that after the inoculations, we'll be able to maybe keep the school systems open?
We need to combine different approaches. One of them, of course, is vaccination. Of course, children cannot be vaccinated for now, so we need to employ much better what is called Magen Chinuch, or protecting education. This is a program promoted by Yuval Cohen from AFAT. It's about pooling. For example, in my little son is 8th grade. We implemented it about several weeks ago. It's voluntary. Schools can join. And they were doing a weekly testing, and this is a perfect way of combining this with maybe some hybrid teaching outside, vaccination of teachers. We need to learn how to live with Corona and do it in a more sophisticated way than just lockdowns. Lockdowns, finally, it's always a failure because there are other ways of dealing with that. And now we're in a situation that unfortunately we needed to have something that is more stringent than before.
All right, well, failure or not, of course, the top question on everybody's mind is, are we going to head to a fourth lockdown, especially given what, you've just touched upon earlier, that while the majority of the population is adhering as best as they can to the rules, there are still pockets of the population that are flouting them.
So first of all, I hope that by next week we're going to see already some results, and we're going to have another thinking about what should be the length of the lockdown. And later on, I really hope that all what we are suggesting as the expert committee will be adopted, because having these recurrent lockdowns, this is really destructive for society. We are not a machine, that you can push on, off. Entering into lockdown, returning, all of this needs lots of energies. We need to be more sophisticated, more gradual, and also being responsible from all parts of society, both the government and the communities. I know that many places, the local authorities, municipalities are working very hard, so this is very important.
All right, Professor Davidovich, thank you so much for giving us your time.
Thank you.